we're going to be talking about neonatal abstinence syndrome. This presentation will be done by Molly Prisha, McKenna Kukla, Michaela Dorsey, Emily Young, and Bree Fisher.
So what is NAS? NAS is postnatal drug withdrawal syndrome that occurs primarily among opiate-exposed infants shortly after birth. These drugs can include heroin, codeine, oxycodone, or meth. These drugs get passed through the placenta, which makes the baby addicted to the drugs along with the baby's mother. If the mother continues to use the drugs within the week or so before delivery, the baby will be dependent on the drug at birth. This then means that the baby will go through withdrawal symptoms since she isn't getting the drugs after being born. Some of these symptoms of NAS can include tremors, fever, blotchy skin, irritability, sweating, and rapid breathing. The prevalence of NAS is talking about who and how prevalent this syndrome actually is. In 2013, the incident rate was 6 out of 1,000 births. This number of cases is increasing every single year. This rate is much higher than the 1999 rate, which was 1.5 per 1,000 births. This is a 300% increase since 1999. The state with the highest number of cases is West Virginia, with 33.4 births per 1,000 births, and the state with the lowest is Hawaii, with 0.7 cases. Take a second to look at this picture that shows the incidence rates.
So, something that we have to look at when recording data and performing experiments for NAS is starting off with the SMART objective. So SMART objectives are specific, measurable, attainable, realistic, and timely. So looking at this, we came up with the SMART goal of, by the end of year 2020, 10% of women who are sexually active will be more aware of NAS. The next thing that we had to look off of and base even our SMART goal off of and how we are conducting this entire research was looking at the Healthy People 2020 objective. So we used objective 11.4, which was increase abstinence from illicit drugs among pregnant women.
For our secondary data, we use the CDC's YRBSS, Healthy People surveys, and HINT surveys to base our questions off of. These provided objectives and specific questions to ask our participants. For our first source of primary data, we used our online survey, which was taken by 30 women. The age range of women was between 19 and 36. Only one woman who took the survey was currently pregnant. Our survey data was not completely accurate representation of the awareness of NAS because of the lack of response of women and the diversity of women who were.
As you can see in this chart, when women were asked about their recent use of a few illicit drugs, the most common used drug among the women who took the survey was marijuana in the last 30 days or beyond. 20 of the 30 respondents said that they had used marijuana in the past 30 days or beyond.
When the 30 women were asked, did you use drugs before you had intercourse last time, only one woman said yes, and the other 29 said no, or that they had never had sexual intercourse before. When explained what NAS is and asked if they had ever heard of NAS before today, 10 women said that they had never heard of NAS, and the other 20 said that they had. We also did some interviews as another source of primary data. We interviewed women who are currently pregnant or have been pregnant. This slide shows questions that we have asked our interviews. Take a second to read through the questions. We started off by asking about their demographics. Out of a few people we interviewed, we had one who was currently pregnant, and the rest had been pregnant in the past. All the women interviewed said that they were aware of NAS, but not really in full understanding of its impact. When asked how to raise awareness, one of them suggested an NAS Awareness Month, and an NAS should be assigned a known color of representation. When asked about the Keeping Families and Children Safe Act, all women being interviewed said that they had never heard of it. The small sample of women interviewed does not give a good enough representation of the women in Texas, but it does give us an idea on a few women's knowledge of NAS.
As with any syndrome or disease, there are levels of prevention and how to prevent and protect not only the child, but also the mother in the case of NAS. So there's 3 levels of prevention as shown here by the chart. First is primary prevention, an intervention implemented before there's evidence of a disease or injury. So this could look like raising awareness or educating people so it prevents them from taking the drugs, which can cause harm to the child. Secondary prevention is next. This is an intervention implemented after a disease has begun, but before it is symptomatic. So this could be screening for women that are already pregnant to see if they have been using drugs, so that way the nurses and the health educators can work with the mother to try to prevent this syndrome from occurring and giving them the help that they need. Lastly, on the level of prevention is the tertiary prevention. This is an intervention implemented after a disease or injury is established. So once someone is diagnosed with NAS, it's trying to reduce maybe the numbers of times that the mother is actually taking these drugs in hopes to not make it as bad as it could be.
The first level of prevention that we will be talking about is primary prevention. So, a way to have primary prevention for NAS is to seek treatment for addiction. People who are not yet pregnant, but are addicted to drugs, if they, before they even get pregnant, start having treatment for addiction to get off of it, they're going to prevent the case of having NAS for their child. Another thing is to get healthy as a whole. Things like yoga help you both physically, spiritually, emotionally, and mentally. The more that you become healthy in other dimensions, the more it may help you to take back on the addiction. Lastly, that we're going to talk about right now is to practice safe sexual intercourse. If you use condoms or birth controls, things that prevent pregnancies, it's going to lead you to less likely have NAS if you are using drugs, taking drugs while having sex.
The second level of prevention we're going to be talking about is secondary prevention. This can be seen by screening mothers for substance abuse. So when they come in and know that they're pregnant, for nurses to check on that to help address if they are under the influence. Second is to refer treatment, provide community groups for them or rehab for them to help to not take as many drugs or completely stop taking drugs for their baby to prevent NAS. The third level of prevention that we're going to be talking about is tertiary prevention. So some of these actions will be taken after the fact that we have diagnosed the child with NAS. So one of those things is to understand the long-term risks. So if the mother and the child and the family and friends support group and community group around them understand the long-term risks of NAS, we can help prevent and protect the child for some of these long-term risks. Another thing is to work for the reunification of child and the parent. So oftentimes through a list of different policies and acts, the child will be removed from the mother's care for a little bit of time so that she can go to rehab and help herself to stay away from some of those drugs. But the next best thing is as soon as she's good and healthy and responsible to go, is to reunite that family together by bringing the child back in. So there are a list of different federal policies that have been set in place by our government. Some of the most recent and impactful policies have been Keeping Families and Children Safe Act of 2003, which requires states to alert child protection workers when a child is born with NAS and is identified. It also requires the mother to enroll in rehab if the addiction is currently present, and allows some of those workers to do home checks to check on the safety and protection for the child. Another act is Protecting Our Infants Act that was put together in 2015, which requests government support to improve data and design prevention techniques for NAS. This was signed by Obama in 2015. The last one we'll talk about in federal policy is Comprehensive Addiction and Recovery Act of 2016. This is a broad approach to prevention, expansion of treatment, and inclusive pregnant women and children. This was signed, again, by Obama, but this one was signed in July 2016. There are several policies that are set in place but what we're looking for is more widely known about these policies, as well as to make these a little bit impactful and have the health workers know about these a little bit more so that they can check up on people.
Aside from illegal drugs causing NAS, prescription drugs, also known as opiates, can cause NAS. Pregnant women who abuse their prescription drugs can affect the development of their baby. So the government has put together a plan to regulate the prescription drug crisis, and this plan is known as the White House Plan, an epidemic responding to America's prescription drug abuse crisis. And this plan involves 4 steps: education, monitoring, proper medical disposal, and enforcement. Step 1 is education. The first step of reducing the rate of syndromes such as NAS is education. All ages should be informed of how their decisions can affect the health of another human. For example, NAS. Pregnant women who consume illicit drugs or prescription drugs abusively during their pregnancy can affect the development of their fetus. On the other hand, we should also require physicians to also receive education on the safe use, proper storage, and disposal of prescription drugs. Step 2 is monitoring. Prescription drug monitoring programs are a highly effective tool utilized by the government officials for reducing prescription drug abuse and diversion. These programs collect, monitor, and analyze electronically transmitted prescribing and dispensing data submitted by pharmacies and dispensing practitioners. Implementing these programs will, in hope, reduce the number of overdose deaths. Step 3 is proper medical disposal. Develop convenient and environmentally responsible prescription drug disposal programs help decrease the supply of unused prescription drugs in homes. And Step 4 is enforcement. Enforcement is the area we need most improvement. By using the Keeping and Families and Children Safe Act of 2003, this law was created to serve to both protect infants who are born with NAS and help the mothers in this act. This will provide law enforcement with the tools necessary to eliminate improper prescribing practices and stop mill pills.
Neonatal abstinence syndrome is still a very prevalent issue in the United States, but it isn't something that gets discussed most of the time. In order to help decrease the number of cases each year, it's important to educate the public about what NAS is and how to prevent it. One way communities are starting to raise awareness is by making October the National Awareness Month for NAS. Healthcare providers and educators use this month to really push the issue to try and reach as many people as possible. There is also a trend on social media that has just begun called pearls and bow ties, where people wear either a pearl necklace or a bow tie to help spread awareness across the internet. Another great way to spread awareness and raise money at the same time is through partnerships with companies. The main organization that does this is called March of Dimes. This organization helps provide care for mothers and babies affected by NAS and also works to improve policy in state and local government to prevent NAS. March of Dimes also does a great job of spreading awareness by partnering with companies to put out donation buckets so that consumers can learn more about the syndrome and make donations. This not only gets shoppers engaged, but also helps the companies that partner with their organization. All of these are ways that improve education and awareness about NAS and can make a significant impact on reducing the number of cases each year. Thank you so much for listening to our presentation over NAS. I hope you learned something.